Welcome everyone to IsisParenting Sleep Support Webinar and Chat. My name is Nancy Holtzman. I'm a mom and baby nurse educator, board certified lactation consultant, and board certified in pediatrics. And I'm the Vice President of Clinical Content and e-learning here at IsisParenting in Boston, Massachusetts, and coming soon to Atlanta and Dallas-Fort Worth. So every Tuesday at 12 noon, we meet in our sleep webinar chat room, and we cover a new area about sleep support for infants and toddlers. One of our most popular sleep webinars and a very popular sleep approach is called Trading Down Sleep Associations, something you'll really only find referred to here at ISIS. And we are going to answer very common questions and concerns regarding using this method. So I see we have a lot of people in the chat room today that are new, which is awesome, and with a wide variety of questions. I will give you an overview of some of the sleep webinars that we already have recorded, because if you're brand new to the ISIS Parenting Sleep Support Program, which is comprised of blogs, articles, webinars, which are live like this one, and then the recorded archives, as well as sleep consults, you'll hear us refer to certain webinars over and over again. So if you're a first timer, I would highly recommend that later today or tonight or tomorrow, you find the correct sleep and nap patterns webinar that is age appropriate for your child, because we have, I think, 5 different ones. And that will give you a general overview of sleep, the sleep environment, typical expectations by age and stage, and quite a few tricks and tips and suggestions to help gently nudge your baby into the sleep pattern that would be more developmentally and socially fit in terms of adult sleep as well. So gradually you'll probably want to get your baby into a typical bedtime with a bedtime routine, and then manage night wakings in an age-appropriate way, resettling, feeding, and so on, and then help your baby get adequate daytime sleep, and you'll find that naps transition throughout the first year from no particular nap pattern to 3 to 4 naps to 3 naps to 2 naps to 1 nap, and so on. So we'll kind of guide you through that, always in a very gentle, nurturing, flexible approach, and specific topics that may be applicable you'll find in the sleep webinar archives as well. So today we're talking about trading down sleep associations, which is a very specific approach, and Meg will review that, and we will answer the common questions that come up as people begin to experiment with this approach. So joining me today, as she does every Tuesday at 12 noon, is Meg Casano, my friend and colleague, who is also a registered nurse. I'm the mother of 2 teenagers. She's the mother of 4 beautiful young daughters, and I'm here in Boston, and she's in Connecticut, and together we bring you this live webinar. So Meg, would you like to finish your own introduction, and then we can begin the topic of the day?
Yeah, thanks, Nancy. No, that's great. I think I'm gonna just jump right in. Thanks for joining me, everyone. So like Nancy said, this particular topic is about frequently asked questions as they relate to the Trading Down Sleep Associations approach. So I'm sort of assuming in some ways that those of you who are listening, who might come back and listen, that you're familiar with this approach, but I am just going to do a quick review. The Trading Down Sleep Associations, there are a lot of different types of plans, called a lot of different names by a lot of different people, and so on. I have to say, this is something that you will only find in this way at ISIS. One of the nice things about Erin and I and the whole sleep team, having done thousands and thousands of consults with families, and Erin's going to all the sleep conferences and up on all the current research all the time, that you really you've got your finger on the pulse of everything that's happening in infant and toddler sleep. So it's really just an awesome place for you to be. And so this is sort of an approach that we've created from other maybe popular sort of along the line of other popular approaches you may have read about or heard about, but we find it to be very intuitive and a really nice way to sort of gently help your baby learn to sleep in the way that works best for your family. This particular approach is not for all families, and that's fine. That's another beautiful thing about ISIS, that we don't force anyone, and we don't say there's just one way to do this. There are lots of different ways to do this. This is just one approach. But the trading down sleep associations is slower and more soothing, which also means it's more of a time commitment. And so, you have to evaluate your family and ability to be consistent for a longer period of time. When you're starting your trading down sleep associations, you're determining your high soothing. That's sort of what I call your fail-safe. Like, your baby's crying, it's 2 a.m., what works? Is it nursing? Is it snuggling and bouncing on a physio ball? Is it shushing and swaying? I mean, you really need to evaluate what's your fail-safe, what's your high soothing, and then you're determining what are you going to trade for? What's your next step down? If it's nursing, maybe you're trading to rocking. If you're already at rocking, maybe you're trading to crib side soothing, rubbing the back in the crib. Really, the sky's the limit on how many trades you want to make, from nursing to rocking to crib side soothing to sitting next to the crib to sitting in the middle of the room to sitting at the door to being out of the room. You can do as many or as few of those as you want. And what you do is you alternate back and forth between your high soothing and low soothing with your baby until sleep is achieved. So you are soothing your baby 100% of the time, and at least for the first several trades, your baby is never alone. But you are trading back and forth between these positions of more soothing and less soothing, high soothing and low soothing, and you're always ending. In other words, your baby is falling asleep always in the low soothing spot. So that's sort of the brief overview. If you need more information on this, the specifics, you can check out the webinars that we have recorded for infants and for toddlers. Okay, so frequent questions that I have, families who email me, and these are common questions that Nancy and I field, Nancy on Twitter and email, and me on email. So one of the questions is, well, what if my high isn't soothing anymore? So it worked for a few days, we were making progress, but then I found that it really wasn't soothing. So I would do some troubleshooting with a family and say, okay, sometimes this can happen if your types of soothing in your overnight are different. I'm going to talk more about this on the next slide too. But you really need to make sure that your high soothing is actually soothing to your baby. Some parents feel like they want to start out rocking their baby in their arms because that might be the most comfortable place for them, rocking in a chair or something. But if that's not really something that they've established with their baby yet, it might not work at 3 a.m. when the going gets tough with their baby. So you really need to spend some time evaluating your high soothing before you begin. And you might need to spend some time establishing your high soothing before you begin too. And so, for example, you might need to change a feeding to sleep, like bottling to sleep or nursing to sleep association. Sometimes it's helpful if you spend a few days, you might even spend a week or two figuring out what time your baby needs to eat overnight, so that you don't have confusion in the middle of the night between, is my baby hungry? Is my baby not hungry? What should I be doing at this wake up? Should I be trying to feed or should I be trying to soothe? Sometimes that's where it gets dicey in the middle of the night when you're sort of alternating back and forth. Parents will say, what it amounts to. They'll end up trying, I tried my high soothing and my low soothing and my high soothing and my low soothing, but then I went to extra high soothing. And so, I always say, okay, well, map out your night first. If you need to rearrange some feedings, if you need to gently reduce some feedings, so that you are beginning your night knowing what time you're going to be working on your trading of associations and what time you're going to be offering feedings. More about this in the next slide. Now, the other thing that happens sometimes is your baby might have different soothing needs at different times of the night. For example, your baby might be making great progress at bedtime, and you can put your baby down and just rub her back and she'll fall asleep in her crib at bedtime. But in the middle of the night, if your baby's accustomed to being nursed back to sleep or bottled back to sleep at every wake up, you're not going to be able to just go to the rubbing back to sleep approach in the middle of the night. So you may be doing different trades at different times of the night. For example, your high soothing at bedtime might be rocking in your arms, and your low soothing might be rubbing your baby's back at the crib side. But at 2 a.m., your high soothing might be having your baby actually latched on and nursing or sucking on a bottle, and then stopping that latch and trying to rock your baby to sleep. So you have sort of a latch on, latch off, and rock. Latch on is your high, latch off and rock is your low. And so you can actually be alternating back and forth between different trades at different times of the night. Again, though, it may be helpful for you to spend a week sort of preempting that situation and figuring out how to rock your baby to, figuring out how to have rocking be comforting for your baby at all wake ups so that your trades are consistent at each time during the night. Okay, so I guess I'll say this in another way. You may need to be doing different high soothings at different times of the night. So the high you're doing at bedtime might be different than the high you're doing in the middle of the night. But if you feel that your baby's finding that confusing, you may need to spend some of sort of an evaluation week getting your baby used to the same high soothing all night. And this would be, this is often where the individualized sleep consult is so helpful because different families have different soothing types and different feeding times and different scenarios going on. But that's sort of the nuts and bolts of it. The other thing that goes on sometimes is you need to evaluate your baby's temperament. Now with the trading of sleep associations, I recommend parents stay in their low soothing spot as long as they can until they get to their stress point. For some parents, that's like 15 seconds. And for some parents, it's 5 minutes. So depending on the amount of time you're going to spend in your low soothing spot, is going to determine how quickly you're moving through your trades. If your baby seems to be getting a little confused, a little frustrated by that, you might want to switch to an approach lovingly created by our very own Erin Evans that she calls a timed pickup approach. This is sort of a hybrid, again, of some other, kind of philosophies that you may have read in popular books, but this amounts to basically timing your trades, where you end up saying to yourself, okay, I'm in my low soothing spot, and I'm going to see if I can stay here for 1 minute. And after the minute, you move to your high soothing spot, and you settle and get your baby used to, back to sleepy using sort of your fail safe, your high soothing. And then you go back to your low soothing again, only this time you do another time interval, you may a minute and a half, or maybe 2 minutes. And so this structures the intervention more for parents. Some parents really benefit from that. Some babies really benefit from that. It also does generally help you move through your trades more quickly. Okay, question that we get, it worked for a few days, but then we stalled. And for this, again, that my troubleshooting, I'm always asking, okay, well, are you sure your baby is falling asleep in your low soothing spot? For example, when you scooped your baby up and got him in your arms and started rocking and bouncing and holding, did he fall asleep, or did he actually get into a light sleep state before you then placed him back into the crib and started rubbing his back again? Sometimes it's hard. I know this can be very tricky, especially in the middle of the night. Sometimes the first states of sleep can actually appear like wakefulness. He fluttered his eyes once, or he looked at me and then closed his eyes, and so parents are interpreting that as being awake, when really the baby might already be, in the first states of sleep. So you are making sure that sleep is being achieved in the low soothing spot. You're making sure you're always starting this at bedtime. You're not starting this in the middle of the night. You're staying goal oriented. And what I mean by that is, even if you have to write it down that night, you're sort of saying to yourself, okay, what's my high soothing? What's my low soothing? And making sure you are alternating back and forth between those two levels of soothing and not adding the extra high and the low and the super low and sort of like waffling all over the place. You're very, this is a fluid plan, but this also does have to have some structure to your soothing levels as well. Always, if you're experiencing, if you feel like you're stalled or plateaued in any way, you want to evaluate the timing of night sleep, bedtime, daytime sleep. The schedule and the daytime sleepiness and bedtime sleep pressure can all impact, the adaptability of your baby and learning a new way to fall asleep. And then, of course, the challenge of slower approaches, any slower approach, is it does take longer. And so you run the risk of, baby getting sick, traveling, developmental milestones, teething. You might want to check out the webinar that we recorded on sleep disruptions and motor milestones to help you determine what sort of a legit kind of, okay, maybe we need to go on hold for a few days, get baby healthy again. If you do find that you need to go on hold, try not to, I shouldn't say try not to, but it's helpful if you hold steady as much as you can. For example, if you're sort of in a position where your baby's getting really used to being rocked to sleep as opposed to, say, nursing or bottling to sleep, just try to stay there for a few days. Don't work so much on transitioning down to the next level if your baby's sick, but at least try to stay at the level you are. When your baby's better, you get right back on track with your trades. When you're traveling, same kind of thing. If you have a good sleep environment wherever you're traveling, try to maintain the soothing level that you're on. You might not expect to keep trading down while you're traveling, depending on where you are and how familiar your baby is with that environment. When you get home and settled, you can get right back on track. Okay. So, and I think this popped up in one of the webinars. I think Nancy might have gotten a question about this on Twitter too, where a mom said, well, I tried this, but my baby cried for an hour. Is this normal? And so my answer is the time it takes your baby to fall asleep at bedtime may very well be an hour. Yes, it may take your baby an hour or more to fall asleep in a new way. And the older your baby is, the more sleep pressure your baby can withstand. And so, might be able to stay awake for quite some time and resist falling to sleep under new circumstances. But the goal of this particular method is not that your baby should be crying for an hour. So the answer, to that, in my opinion, would be no. It's not normal in this method for baby to cry for an hour, although it is normal that it might take your baby an hour before falling asleep. And so if you're feeling like you like this idea, but you're having more crying than you anticipated, a couple of things. You might want to consider lessening your time spent in low soothing. I had a mom one time say, well, I spent as much time as I possibly thought I could in low soothing, and for her that was 5 or 6 minutes. But during the time she was offering the low soothing to her baby, and again, her baby wasn't alone, but her baby was crying, and she was feeling very stressed by that. So I tell people, get to your stress point. If it's 15 seconds of practice in the crib, rubbing your baby's tummy or stroking your baby's cheek, that's fine. Then pick your baby up and hold and bounce and rock and snuggle and soothe, get everybody happy again, and then put your baby back down. Now, you may very well be repeating this for an hour or more, but if you're spending more time in your high soothing, there would be less period of time when your baby is upset, if potential for your baby to be upset in the low soothing spot. Again, you would need to check the effectiveness of your high soothing. Your high soothing really should be something where you scoop your baby up and you do your high soothing and you know that it works. So you're making sure that high soothing is effective. Again, you're checking timing, making sure your baby's not, ragged from a day of terrible naps. You had a regular bedtime routine. Sometimes babies are falling asleep in mama's arms for 20 minutes and then they're putting the baby in the crib awake and trying this, but baby just had essentially a 20-minute nap. And so, it takes much longer to fall asleep. So there are things about the bedtime routine that I look very closely at. You're also making sure you're not trying to do this through a habitual hunger. Remember that the circadian rhythm, among other things, does drive for digestion at regular times. So if your baby's used to eating at 10 p.m. every night, even if your baby's past the point of needing to eat at 10 p.m. every night, his little body sure thinks it needs food then. And so you'd never try to plow through a feeding cold turkey. You would always gently wean it down. And then finally, we have to sometimes look at a temperament mismatch for baby. If you need to go to a more structured approach, like a timed pickup approach, or perhaps maybe even something that's even slower and soothier. If you feel like you're stalled and you're really doing everything perfectly, then generally you look to make a change, either more soothing or less soothing, depending on your desires. And again, this is sometimes where conversations, there's only so much troubleshooting I can do over the internet. A lot of this is, well, okay, tell me exactly what happened. Tell me exactly what you did, step by step by step. I sometimes like to make sure too, because I've had a couple of moms say, well, I started doing my trades, and after 40 minutes, it was clear that she just wasn't going to sleep. So I rocked her, which is fine. That is your prerogative as a parent, absolutely, to do that. But it's clear then why the progress wouldn't be being made. That in order to make these trades, or in order to make a change in the way your baby's falling asleep at bedtime, you've got to make a change in the way your baby's falling asleep at bedtime. Okay, so another question that comes up a lot is mom versus dad as soother. And here again, where sometimes individualizing this is so helpful, but sure, different caregivers might be doing different trades. If mom is working on trading from nursing to sleep to rocking to sleep, dad might be working on rocking to sleep to soothing from the crib side. And that's fine. Your timing would still be consistent. Everyone's on the same page. Everyone's working towards the same goal of sleep initiation independently. They just might be at different stages getting to that process. Babies are so good at compartmentalizing how they sleep with different caregivers. You guys might notice with your own babies that, they sleep great at daycare or with a sitter and not at home, or vice versa. They sleep great with mom and not with dad, or they sleep great with grandma and not with grandpa. I mean, it's very, very common. And you pick your family goal. Is it just learning to initiate sleep on their own? Is it initiating sleep and having the first third of sleep consolidated in a crib? Is it reducing a night feeding? Do you want full night perfection? You're sort of thinking about your baby's age and stage and what your family goal is, and then everyone's working together to achieve it. The question that I don't know if we recorded on the original webinar was, can I do this for naps? And the answer is yes, definitely. The trading down may be used during the 1 hour nap challenge. And the thing with soothier plans during the day sleep is generally more difficult, takes longer to fix, to come together. And so you want to just know that it would be perfectly normal for you to have slower results, and that's okay. A lot of times, actually, parents don't mind that, because during the day, it's actually a lot easier, tends to be easier for you to be consistent because you're awake. Your ability to follow through at 2 in the afternoon is a lot different than 2 in the morning. Again, you're always patient, consistent, you're setting goals for yourself, and you're making sure you're always working towards them. Okay, I love this picture. This is so cute. Okay, so I hope that answered some frequently asked questions about trading down sleep associations. And as always, I or anyone from the IsisParenting sleep team are always happy to help you individually as well. Okay.
As you can imagine, we have a number of questions on this topic. Some of them, I'll try to focus on key topics. Can you talk a little bit more about feeding? I know we have a whole webinar on
Yeah.
gently reducing
Yeah,
nighttime
sure. And
feedings, but
I'm
how
the
do you
first to
know, how
admit
do you
I am
decide
quite
when to work
conservative
on
when it
trading
comes to
down,
nighttime
if it's still
feedings.
the first third of the
You
night or
know,
the first
I
two-thirds of the
tend to
night, or how do you
go with
know
the
if the
standpoint
baby
that even
truly
in the
is
first
hungry? One of
year,
your key
especially for
points
nursing
was not to
moms,
make sure that you're not trying to trade down
especially
sleep association when the
between,
baby's
well, let
actually
me start
hungry. So
over.
can you help some of the
0 to 4 months,
first-time
it's on
moms?
demand. And I should say too, trading down sleep associations generally starts with babies who are over 4 months old. So if your baby's under 4 months, you could start experimenting with some of this in a gentle way. But this would be really for babies who are over 4 months. So feedings before that point are on demand. Between 4 and 6 months, most babies are having 1 to 2 feedings in the night. Unless your pediatrician is telling you otherwise, your baby doesn't need more than 2 feedings in the night. And between 6 and 9 months, I even go so far as to say between 6 and 12 months, if your baby's having 1 feeding in the night, but sleep is well consolidated before and after that feeding, it's not a sleep problem. Doesn't mean your baby needs it. It doesn't mean you like getting up once in the night, but it's not a sleep problem. And so you sort of have to, you make the call a little bit, and I say use your intuition. If your baby's 7 months old and he's doing great and he's a big guy and your pediatrician's been telling you for 6 weeks he doesn't need to eat and you're exhausted and he's eating twice in the night, absolutely reduce a feeding. Generally, it works best to reduce the earlier feeding first. Like, for example, if you have an 11 p.m. or 12 o'clock feeding, you reduce that first. And so then you'd be in a position of saying, okay, I can work on my trading down sleep associations anywhere from bedtime all the way through first long stretch of the night, generally about the first 2/3 of the night, and you would have a feeding somewhere in the last third of the night. So you do sort of have to decide when your baby needs to eat. If your baby needs to eat, you need to feel really confident with your decision. That's very important, and you'll know if in your heart if it's really the right thing and you're all ready for it. Because in the middle of the night at 1 a.m., if you're doing a gentle wean down and you're reducing calories and you know this is part of the process, so you are meeting your baby's needs from a biological standpoint by reducing calories, but there's still going to be a psychological side. Your baby might still resist you because he wants to be nursed to sleep and he wants to be, in your bed co-sleeping if that's what you've been doing. And so just because you're getting resistance at doing a trading down sleep association at 1 a.m. doesn't mean it's not working and doesn't mean it's because your baby's hungry. If you've made the decision that it's time to reduce a feeding and you've done it in the proper way, then you should feel confident continuing through your trades in a very consistent way. I don't know, does that help, Nancy? Okay. Yeah, so here again, she can make decisions based on what works best in her arms for her baby. If she's got to be
Okay, now
bouncing on a physio ball and
very
really
helpful.
working at it to get
And then
her
we have
baby to
quite a
sleep,
few
and she
questions
wants to go
about
nice and slow
trading
with this,
down. How do you
maybe
determine
bouncing and
what will be
snuggling
your
and
high
rocking
and
on a
what will be
physio
your
ball,
low?
sort of a
So, for
high
example, this
intensity
mom has a
soothing in
5-month-old,
arms
and she
is her
wants to
high,
know
and
if
maybe
my baby
just
will only
sitting
sleep in my
and
arms. What is a
holding
logical
calmly
first trade?
with some very gentle rocking is her low. Or maybe she's feeling like, I really am ready to have my baby go in the crib, then I would go straight to crib side soothing. So rocking and holding in her arms would be her high, and standing at the side of the crib with her baby, rubbing his back, rubbing his tummy, petting his bum, stroking his cheek, shushing, that would all be fair game for the crib side soothing as the low soothing.
Okay. All right. And then this mom, I want to get to her question. She was the early bird. She was the first one in the room today, but it's a long question. Let's see. So I'll try to summarize. Baby's 14 weeks old. Mom's been doing some great sleep work. Baby typically sleeps 7:30 p.m. to 6:30 a.m. with one wake up. Yay, is what she says. They have been trading down from nursing to sleep. Instead, they're now bouncing and shushing, putting her down awake, and it seems to be going okay. But the last few nights, she's starting to wake up 2 or 3 times a night. Nothing else has changed.
Okay, so
Room
I guess the
environment
first
is cool,
question
dark, and
first, her
quiet.
baby is not
Could
even
wake ups
14
be
weeks,
related to
so not
changes
even at
in
the
going to
4-month mark.
sleep? Um,
Baby's
hmm.
circadian rhythm is
That's one part of
still
the question. And the second
developing
part of the
for night
question
sleep and has
is
not even, her
transitioning from pack
daytime
and
nap
play to
pattern
the
is not
crib
even,
and from
I don't want to
swaddle
say
to
it's not on the
sleep.
horizon, it is.
How do you recommend
But
timing these things
this
over the
baby is
next month
still
or so?
quite
Do you do
young
the
for
the
full night
transition from the
consistency
swaddle to
and,
the
and
sleep suit
perfection. I
first,
think
or
it's
do you
awesome
do
that she's working on
the
this. I think it's
transition
awesome that she
to the
is,
crib
and
first? What
appropriate
do you think,
that
Meg?
she is working on her bedtime routine, getting a nice regular bedtime, getting a long stretch of sleep, especially that first third of the night, deep consolidated sleep. Those are all very appropriate expectations, and it sounds like she's getting that. The last third of the night for a 14-week baby is what it is. Even I don't have a magic wand for that. And so the best you can do is, Christina, if you're up for it and continuing to try to trade down those sleep associations, great. But I wouldn't do it at the expense of sleep at this point. So in other words, if it's 4 in the morning and you're all exhausted and you just need to rock your baby to sleep, or you need to do sort of a bonus nursing session to get her to sleep, it's okay. That time of the night is very difficult with more REM states of sleep, lower sleep pressure. I'm guessing you know this because you sound like you're using some of the lingo in our webinars. So I don't mean to push off your question. It sounds like you're doing a really great job, and for the age, you're doing about the most you can be. It's usually not until about 6 months that we say, okay, now you really go for it in terms of full night consistency. I don't know, maybe just knowing that information is helpful.
Okay. Yep, I think so. And I think the swaddle transition it probably is an easier one. When the baby is in the Magic Merlin sleep suit, you may have better luck than transitioning to the crib from the bedside sleep location. Okay, last question. I think it's a fairly quick one. Then we need to wrap up.
Yeah, I mean, at 5 months, the
Is the
baby's
pacifier
too
something to
young to
trade
be
down from?
teaching how to
This
find the
mom has a
pacifier.
5-month-old who
I
is
mean,
generally doing
certainly
well
could
with
try,
sleep,
but
as long as she
it's
can give
not
him the
so likely that
pacifier
at
when
5
he has
months
a
he's going
wake
to be
up and
finding
doesn't
his
need
own
a feeding,
pacifier
which is
and putting in
fine
his
for
mouth.
now because
You
she
certainly
sleeps
can
next to him
trade
in the
down from the
co-sleeper, but
pacifier, do the
eventually she'd
same
like
as
to
if the
have
baby
him
was
in the
relying
crib. So I know we did a
on sucking to sleep in another
full
way,
week
like
on
nursing
infants,
or having the
toddlers, and
bottle,
pacifiers.
where you might let
But what do
him,
you think in
if
terms of,
that's
is
your
the
high soothing,
pacifier
he
a
gets
type
to
of sleep
suck, suck, suck to
association
kind
to
of
do a
calm
trade
and
down
settle.
from, or
And then
do
you take the
you
pacifier out to try for sleep.
should we
And then if he's getting
encourage the
skitchy and fussy,
self-replacement of the
put it back
pacifier
in and
and
let him
things like
suck,
that?
suck, suck to calm down. But you take it out to let him soothe and settle. I mean, yeah, you could do that. That is one way you could use the pacifier as trading down. It's your high soothing, and your low soothing would be not having the pacifier.
Right.
Some parents like to just replace it right off the bat by just rocking through it and just sort of like what I sometimes call just kind of muscling through it. Just hold him, get him in your arms, shush, snuggle, calm, and know that, at some point he will fall back to sleep. But if you want to use intermittent passive replacement to navigate that time, it's fine. You might also want to just work on getting him to sleep without the pacifier at bedtime. And then maybe if he's lying right there next to you in the co-sleeper, maybe the last third of the night, you use the pacifier just for now, as a tool to get you through on the path to more independent sleep when he's a little older, and then you stop at full night.
All right, and I'll also put the link to the infants, toddlers, and pacifiers
I think we're going to switch it up to some toddler stuff.
So it is 12:37.
So
I think we need to
you
wrap
guys have
up
little
for
babies,
today. We
this
had
is
a great
helpful
full
for
house.
the
Thank you,
future.
everybody, for attending. This Thursday's breastfeeding webinar is all questions and answers, so come with any breastfeeding or pumping questions that you might have at 12 noon on Thursday. And I will post the topic for next week's sleep webinar. I think, Meg, did you have the topic planned? I think we've been getting a lot of questions about dreams, nightmares, and night terrors. And I think, were we going to talk about toddlers and nighttime fears and terrors? Okay. Yep. And you can sound knowledgeable when your friends have with older babies have questions too. Okay, thanks so much, Meg, for sharing your expertise. Thank you to all of the people that came into the chat room today and shared and supported one another. And we look forward to seeing you back next week. Please help us by spreading the word on Facebook, Twitter, and email groups. Please like us on Facebook and sign up for our weekly age and stage-based newsletter. So that way you'll stay up to date on everything that ISIS is offering. And we have lots and lots of free online webinars coming up. Positive discipline I just added. We have a great webinar on the 11th on family-centered C-section, which is skin to skin and direct breastfeeding perioperatively. Very cool, and a bunch of other stuff going on.